Theme number 11, Brucella and Legionella. Plan of the theme, the properties of Brucella, Legionella and epidemiology of brucellosis, legionellosis and pathogenesis of brucellosis and legionellosis and clinical manifestation and laboratory diagnostic methods. Brucella is an obligate aerobic, fastidious, non-sporing, non-motile, non-capsulated, small gram-negative coccobacillus, responsible for a highly contagious febrile illness called brucellosis. Brucellosis, also called undulant fever, is primarily a zoonotic disease affecting various domestic animals such as sheep, goat, or cattle, and the human infection is usually associated with occupational or domestic exposure to infected animals or their products. Antigenic structure of Brucella. Brucella have two major types of lipopolysaccharide antigens designated as M and A, and they are present in varying proportion in the three major species of Brucella. However, one of them is predominant in each species. In most of the biovars of Brucella melitensis, and M antigen is predominant, and in most of the Brucella abortus biovars, A antigen is predominant, and the Brucella suis biovars contain either M or A antigens. And the virulent colonies on primary isolation are smooth and possess the lipopolysaccharide antigen. However, on repeat subcultures, strains may lose lipopolysaccharide and becomes rough strains which may not agglutinate with anti-M or anti-A antiserum. And Brucella canis produces rough strains even on primary or A antigen, but agglutinate with antiserum prepared against R strains. And Brucella belongs to the family Brucellaceae. Brucellaceae species Brucella melitensis, Brucella abortus, and Brucella suis. Brucella melitensis colonies on blood agar colonies in this slide. Culture media blood culture bottles are the recommended media. Biophasic media castanedas are superior to monophasic media, and brain-heart infusion broth or agar or serum dextrose broth or agar are the appropriate media used, and repeat subcultures are made onto blood agar and chocolate agar. Biophasic media have less contamination rate, as the colonies can be obtained on the solid phase just by tittling the bottles so that the broth runs over the agar slope, and thereby avoiding contamination during subculture. Blood culture bottles should be incubated at least for 2-4 weeks or more, and on blood agar and chocolate agar colonies are small, smooth, transparent, low convex with entire edge and non-hemolytic, and gram staining of colonies reveals non-capsulated, non-sporing, small gram-negative coccobacilli, and the Brucella are non-motile. Nomen species on first column species in the middle biovariant, and the third column is host. Brucella belongs to the family Brucellaceae. DNA hybridization studies reveal that the members of the genus Brucella are very closely related and probably represent variants of a single species. However, for the sake of convenience, these have been classified into nomen species based on various properties such as preference of animal host and CO2 requirement and hydrogen sulfide production and genetic composition and bacteriophage susceptibility and the tolerance to bacteriostatic dyes and agglutination with monospecific antisera. And currently there are 6 nomen species identified, among which few are further classified into several biovars. Brucella melitensis, it has 3 biovars, and it is usually pathogenic to sheep, goat, and camel. Man is also a susceptible host. And the second is Brucella abortus. It has 9 biovars, and infection is acquired from cattle and buffalo. And Brucella suis, it has 5 biovars, and they infect most often pigs, but some biovars may infect renders and rodents. And Brucella canis, it causes abortion in dogs. Occasional cases of human infection have been reported. And Brucella ovis, it causes reproductive disease in sheep. And Brucella neotomi, it infects desert rodents. Resistance of Brucella. Brucella are sensitive to sunlight, ionizing radiation, and moderate heat. They are killed by boiling and pasteurization. And they are resistant to freezing and drying, which renders Brucella stable in aerosols form and facilitating airborne transmission. The organisms can survive for up to 2 months in soft cheeses, 6 weeks in dry soil, and 6 months in damp soil or liquid manner, kept under cool, dark conditions. And Brucella are easily killed by common disinfectants, and their efficacy decreases at low temperatures or in the presence of heavy organic matter. And the epidemiology. Epidemic area. Human brucellosis is endemic via areas where animals are raised in large numbers, such as countries of Mediterranean zone, Eastern Europe, Central Asia, Mexico, and South America. And prevalence, the true prevalence of human brucellosis is difficult to estimate. Many cases are underreported, either because they are inapparent or due to difficulty in diagnosis. Source of infection are infected animals excreting the organisms in urine, milk, placenta, vaginal discharge, contaminated animal food products such as dairy products, especially soft cheeses and milk, ice cream, and raw meats and bone marrows. And people at higher risk are farmers, shepherds, and goatherds, and butchers, workers, and in workers in endemic areas. The main source of the causative agent of infection for people with brucellosis: cows, goat, pig, and their products. Infected animals excreting the organisms in urine, milk, placenta, and vaginal discharge. Brucella mode of transmission. Brucella is the most pathogenic species. Brucella melitensis mainly. Brucella melitensis is the most pathogenic species, followed by Brucella abortus and suis. Human infection with other species is extremely rare. Transmission brucellosis is usually transmitted from infected animals to men. There is no evidence of man-to-man transmission. The various modes of transmission are direct contact and foodborne and airborne. Direct contact. The most common route is direct contact with infected animal tissue, blood, urine, vaginal discharge or placenta, with abraded skin or mucosa of men who are involved in animal handling, and foodborne by ingestion of raw milk or dairy products from infected animals, or vegetables or water contaminated with animal excreta, and airborne by inhalation of dust or aerosols in the infected cow shit or slaughterhouses. The veterinary care, vaccination accident and all laboratory accident with cultures. Their mode of transmissions. Pathogenesis. Pathogenesis organ involved. First, spread. I want to say about spread. From the initial site of infection, the organism spread via lymphatic vessels and next infects the local lymph glands. Next process is organisms spill over to bloodstream, results in bacteremia and leads to disseminate throughout to involve various organs. And organs involved, Brucella are facultative intracellular pathogens, primarily infecting organs of the reticular endothelial system, such as lymph nodes, spleen, liver, and bone marrow, which are rich in mononuclear phagocytic cells, macrophages, and monocytes. And they also have a special predilection for placenta, as their growth enhanced in the presence of erythritol present in placenta, and musculoskeletal tissue and the genitourinary system are also frequently targeted. Local tissue response. Initially, an acute neutrophilic infiltration occurs. Later on, it's replaced by chronic inflammatory cells, leading to granuloma formation with or without necrosis and caseation. And intracellular survival and virulence factors. The cell wall lipopolysaccharide appears to be the major virulence factor. It has a distinct O chain and core lipid composition. Endotoxin activity is relatively low. It plays a key role in providing resistance to phagocytosis and the serum complement-mediated killing of bacteria, suppressing phagosome-lysosome fusion, and diverting the internalized bacteria into vacuoles located in the endoplasmic reticulum, where intercellular replication takes place and the development of pyrogenicity. And host immune response, cell-mediated immunity, is the key to control the infection. Activation of T helper 1 cells provides protective immunity by production of interferon gamma, which leads to macrophage activation and killing of intracellular brucella. And on the other hand, T helper 2 activation leads to secretion of interleukin 4, interleukin 6, and 10 that downregulates the protective T helper 1 immune response and stimulate humoral immunity. Clinical manifestation of brucellosis. The incubation period varies from 1 week to several months, and the onset is either abrupt or more often insidious. Classic trait. The manifestation varies. The classic trait of fever with profuse night sweats and arthralgia, arthritis, and hepatosplenomegaly are present in most patients, and the typhoid-like illness. Second, overall, brucellosis resembles typhoid-like illness, except that it is less acute, less severe, with undulating pattern of fever and more musculoskeletal symptoms. Undulating fever. Fever has a typical remittent course. In between febrile periods there will be afebrile periods. It is also called Malta fever or Mediterranean fever, and the musculoskeletal symptoms are present in about 1/2 of all present, which may mimic skeletal tuberculosis. And CNS, central nervous system depression, and the lethargy with meningitis or lymphocytic meningoencephalitis are the most common neurological manifestations. And the cardiovascular system, endocarditis may occur, and affecting the aortic valve, and the genitourinary manifestations. These include acute epidemiorchitis and prostatitis, salpingitis, and pyelonephritis. Brucella melitensis tends to produce more acute and aggressive presentations. Brucella suis produces focal abscesses. Brucella abortus tends to be more insidious and chronic. Brucella canis produces acute gastrointestinal symptoms. Laboratory diagnostic methods. First is culture smear and motility testing, and the biochemical tests we use, and the serological test, and antibody detection, and standard agglutination test, and the serological test to detect immunoglobulin G antibody, and the molecular method, and the brucellin skin test, and diagnosis of brucellosis in animals. Culture and identification sample. Brucella are recovered from blood, bone marrow, CSF, cerebrospinal fluid, and joint fluid or other tissues. Blood should be collected during the febrile period before starting of antibiotics. Multiple blood cultures over 3 days yield better result. Bone marrow culture remains positive even after starting antibiotics and gives a higher yield than blood culture. Culture conditions. Brucellae are highly fastidious, and the growth is enhanced by the addition of blood or serum. They obligate aerobes, but growth is promoted in the presence of 10% of CO2. And the primary isolation requires prolonged incubation at 37 degrees Celsius. And culture media. Blood culture bottles are the recommended brain heart infusion we use, and blood agar, and we use serum, dextrose, broth, or agar. And on blood agar and chocolate agar colonies are small, smooth, transparent, low convex, with entire edge, and non-hemolytic. And the biochemical tests. Brucella shows the following biochemical properties: don't ferment carbohydrates, and catalase positive, oxidase positive, except some strains of Brucella abortus and Brucella ovis, and Brucella neotomi. And urease test is variable but often rapidly positive, especially with strains of Brucella suis and Brucella canis. And nitrate is reduced to nitrite, except Brucella ovis and citrate, indole, and Voges Proskauer tests are negative. Brucellin skin test, it is an intradermal test similar to tuberculin test. It is no longer in use now. The molecular method PCR, polymerase chain reaction, using primers for RRS, RRL gene, OMP2 gene, outer membrane protein 2. The insertion sequence IS711 are available, and the PCR is rapid, sensitive, and specific, and can also differentiate between the species and the biovars. ELISA test we use, and guinea pig inoculation we use, and diagnosis of brucellosis in animals we use, and the standard agglutination test suitable. And guinea pig inoculation, the specimen is inoculated into the thigh of the guinea pigs, the most susceptible laboratory animal to brucelli. Lymph node or spleen aspirates are cultured after the death of the animals. Legionella are fastidious, pleomorphic, gram-negative, short rods associated with two clinical symptoms. Pontine fever is an acute, milder, flu-like self-limited illness. Legionnaire's disease, severe interstitial pneumonia. History: Legionella was first recognized in 1976 when an outbreak of pneumonia took place at Philadelphia Hotel during an American Legion convention. And classifications: the family of Legionellaceae comprises more than 50 species, out of which 19 species have been associated with human infections, and the Legionella pneumophila is the most important species associated with 90% of human infections. It consists of 15 serogroups. Majority of cases are associated with serogroup 1 and followed by 4 and 6. Other species are Legionella mictadi and Legionella bosemani and Legionella dumofi and Long Beach. And taxonomy of Legionella: kingdom bacteria, division Proteobacteria, class Gamma Proteobacteria, and order Legionellaceae, family Legionellaceae, genus Legionella, and species Legionella pneumophilia. And culture characteristics. Useful specimens for Legionnaire's disease include sputum, bronchoalveolar lavage fluid, and bronchial wash and pleural fluid. Direct microscopy we use, and next is culture method. Culture is highly sensitive 90% and specific 100%, and provides definite diagnosis. And buffered charcoal yeast extract, agar, this nutrition media, and Legionella are highly fastidious and grow on complex media such as buffered charcoal yeast extract, agar, pH 6.8 and to 6.9, and the plates are incubated at 37 degrees Celsius in 5% of CO2 for 3-5 days. Colonies are round with an entire edge, glistening and convex, green or pink, iridescent, and have granular or speckled opalescence resembling ground glass. Biochemical tests, they are motile, catalase positive and oxidase negative, hyporate, and the hyporate hydrolysis test is positive for Legionella pneumophilia. Autofluorescence of colonies under long wavelengths ultraviolet can be used for speciation. And next is pathogenesis. Pathogenesis of Legionella. Pathogenesis after Legionella enter the lungs through aspiration of direct inhalation. The following events take place, and attachment attachment to the respiratory mucosa is mediated by bacterial type 4 pili, heat shock proteins, a major outer membrane protein, and complement. Both macrophages and neutrophils are recruited to the local sites. Coiling phagocytosis, alveolar macrophages phagocytose Legionella by a coiling mechanism. Evades intracellular killing by inhibiting phagosome-lysosome fusion. Because of their intracellular location, humoral immunity plays a minor role. Cellular immunity is responsible for the recovery. Epidemiology of this disease. Reservoir Legionella inhibits on aquatic bodies which could be either natural water source such as rivers, streams, or even inside of amoeba, and artificial aquatic source such as air conditioners, water coolers. The Legionella Long Beach has been isolated from natural soil and commercial potting soil. There is no animal reservoir, and there is no carrier stage, and transmission. Multiple routes have been proposed. Aspiration, predominant mode. Aspiration, it occurs either via oropharyngeal colonization or directly via drinking of contaminated water, and aerosols from contaminated air conditioners, nebulizers, and humidifiers, and direct installation into the lungs during respiratory tract manipulations, and there is no man-to-man transmission. Predisposing factors for Legionella infections include smoking, alcoholism, and chronic lung disease, impair mucociliary clearance, and advanced age, and immunosuppression, transplantation, HIV infection, human immunodeficiency virus infection, steroid therapy, and prior hospitalization, and patient with nasogastric tubes or those undergoing surgery with general anti-anesthesia promotes aspiration. And clinical manifestation, Pontiac fever. It is an acute flu-like illness characterized by malaise, fever, and headache. Incubation period is about 24-48 hours. It is self-limiting, never develops into pneumonia. It is Legionnaire's disease, pneumonia. It is an interstitial atypical pneumonia with incubation period about 2 to 10 days. It is characterized by non-productive cough with or without blood tinged, and dyspnea, chest pain, high fever, and diarrhea. Chest X-ray shows pulmonary infiltrates. Most common neurologic abnormality is confusion or changes in mental status. Legionella is among the leading causes of pneumonia, both in the community and hospital settings. It is the fourth common cause of community-acquired pneumonia, accounting for 10% of cases. It is responsible for 50% of cases of nosocomial pneumonia when a hospital's water system is colonized with organisms. Serogroup 6 is more commonly involved in hospital outbreaks. And extrapulmonary legionellosis, usually it results from blood-borne dissemination from the lung. The most common extrapulmonary site is heart, myocarditis developed, and the pericarditis, and the prosthetic valve endocarditis. And the other manifestations include sinusitis, peritonitis, pyelonephritis, skin and soft tissue infection. And the laboratory diagnostic methods, we use gram stain, direct immunofluorescent test, culture method, biochemical test, antibody detection, urinary antigen, and the molecular methods. Gram stain reveals numerous neutrophils but no organisms, as Legionella are poorly stained, often missed or sometimes appear as faint pleomorphic gram-negative rods or coccobacilli. The silver impregnation and the Gemza stains can be used. Direct immunofluorescent test using monoclonal or polyclonal sera is more specific, but sensitivity is poor than culture. It is more useful in advanced stage of disease. And molecular methods, we use PCR, polymerase chain reaction. Of course, polymerase chain reaction has been proven useful in the identification of Legionella from environmental water. And urinary antigen enzyme immunoassays are available to detect Legionella pneumophila, serogroup 1, specific soluble antigens in urine. Advantages include as follows: it is rapid, cheaper, easy to perform, and next to culture, it is highly sensitive and specific. And the antigen in urine is detectable 3 days after the onset and disappears over 2 months. The test is not affected by prior antibiotic administration.